Hi there. You may have heard about how stress can harm your physical and mental health. But did you know that it can also increase the risk of memory loss, confusion, and dementia? Let's learn more about this important topic. This video is part of a series on how to identify and reduce risk factors for dementia. Dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia are two of the most common types of dementia. Everyone experiences stress. Stress is a normal response to everyday difficulties like deadlines, family worries, or major events like a divorce, loss of a loved one, losing a job, or moving to a nursing home. However, how we cope with stressful situations can vary. For example, your friend might be able to deal well with a level of stress that might feel overwhelming to you, and that's okay. Have you ever felt like you can't sleep because you're overthinking? That might be an early sign that you're experiencing high levels of stress. Other times, stress can be good, helping you to focus on work and complete tasks. Stress can also help you protect yourself. When in a dangerous situation, your body's stress response produces a hormone called adrenaline. This increases your heart and breathing rate and gives you a burst of energy. This response is commonly known as fight or flight. However, experiencing high levels of stress or feeling stressed for long periods of time is generally not healthy. Let's learn how to recognize the symptoms of harmful levels of stress. Some of the responses that people may have when experiencing stress include physical symptoms like headaches, unexplained pain, increased heart rate, and blood pressure. Stress may also lead to emotional symptoms like feeling worried, scared, upset, irritated, hopeless, or agitated. For some people, stress may change their eating or appetite, and they may suddenly become more or less hungry. Stress can also affect sleep, making it harder for some people to fall asleep or stay asleep, while others may want to sleep more than they normally do. Stress can also reduce our desire to socialize with others. It can affect how we think and make it harder to make decisions or remember things. Some people may not be able to cope with stress as easily as others, so they might try to reduce their stress by using alcohol or drugs. This kind of self-medication is often harmful to health and well-being. There are also different types of stress. Some types of stress can occur short-term and will go away when the sources of stress go away. However, chronic stress, that means longer periods of stress, can be damaging. Sources of long-term stress may include being a long-term caregiver to someone, having a demanding job, having an illness, or experiencing domestic violence and other forms of abuse. Some of the negative health issues related to stress are sleep problems, mental health problems, heart problems, hormone changes, and digestive system problems like irritable bowel syndrome or heartburn. Stress can also lower our body's immune system that helps our body fight off infections. Now that we know that stress can be harmful to our mental and physical health, let's take a closer look on how it can be a risk factor for developing dementia. Research has found that chronic stress can be very harmful later on in life. For example, those who are experiencing stressful life events related to financial hardships, health concerns, and work have a higher risk of developing brain damage leading to confusion, trouble with planning, making decisions, and eventually dementia. Chronic stress can also be present during childhood. Researchers have found that children who had to flee to a new country because of war are more likely to develop dementia later on in life. Middle-aged adults who developed post-traumatic stress disorder, or PTSD after experiencing or witnessing a traumatic event are also more likely to develop dementia. PTSD is a mental health problem that occurs to some, but not all people after experiencing or witnessing a traumatic event. It is also important to think about stress among those who have dementia. Losing one's memory, getting lost in places that used to be familiar, and increased difficulty completing daily tasks due to memory problems can be very distressing for those with dementia. Also, stress for those with dementia can be related to changes in family, work, and social relationships. People living with dementia might also experience lower self-esteem as a response to their declining abilities, and lower self-esteem can also tend to make them less resilient when dealing with stress. The good news is that it is possible to prevent and reduce the long-term impact of stress. Here are some effective techniques to relieve or reduce stress. Mindfulness is a practice that involves focusing on the present moment, which means not thinking of events from the past or thinking too far ahead in the future. With mindfulness, people pay attention to what they are currently doing and where they currently are. Practicing mindfulness can help people to manage stress and not feel overwhelmed. There is a therapy program called Mindfulness-Based Stress Reduction, or MBSR, that involves activities such as meditation and yoga. A psychologist or other mental health professional can recommend this program for you, if it fits your needs. There are other therapy programs that can treat stress, such as cognitive behavior therapy, or CBT. CBT and similar therapies can also be modified to fit the abilities of people living with dementia. Engaging in meditation can decrease both depression and stress. It has been found to improve both quality of life and sleep among those living with dementia. Yoga has also been shown to make it easier for people to deal with stress. Participating in art, music, and dance therapy have also been shown to be effective in reducing stress and anxiety. These are just some of the options to choose from when starting your stress reduction journey. If you feel like these options may not work for you, there may be other therapies or medications that your doctor or mental health professional will be able to advise you on. There are also ways you can help manage and reduce stress through lifestyle changes. First, eating a healthy diet and getting a sufficient amount of sleep can make a big difference to your overall mood and energy. The second way is by learning how to set boundaries and saying no to others when you feel overwhelmed or tired. Modern life is complex, and we often get asked to do more things than we have time for. So setting priorities and learning how to say no is a good strategy for reducing stress. Setting boundaries will allow you to have more time for yourself and the opportunity to try out a new hobby or do activities that you enjoy. Some activities include exercising, journaling, gardening, dancing, or other things that might be calming and relaxing, like listening to music or reading. If you are having trouble managing stress on your own, do not hesitate or feel ashamed to ask for help. Your loved ones care about your mental health, and there are many health professionals that are always willing to support you in times of need. Reaching out to a professional may be the most effective way if the other approaches mentioned here aren't effective. For caregivers and loved ones, here are some ways you can assist with managing stress for a person living with dementia. If you're already aware of a stress management strategy this person has used in the past, such as meditation, praying, walking, or coloring, try to encourage them to continue practicing those activities. You can also do some form of physical activity with your loved one, like walking or dancing, which has been proven to provide stress-relieving benefits. Alternatively, think about a hobby or activity that your loved one may like to do and see if you're able to accompany them and enjoy some time together. Lastly, listening to music can be a way to relax and distract from the stress your loved one with dementia might be facing. If you're feeling stressed, don't be afraid to share how you're feeling. Remember that you're not alone. Everyone feels stressed from time to time. which is why it is important to reach out when you feel like you need support.